Okay, I hope that you all can hear me, but use the chat if you can't. That worked really well. So good job. We all got our technical practice in for today. So my name is Katie Hubbard. I'm the coordinator of the Sparrow Lifetime Program and also the privileged presenter for today's Understanding Chronic Conditions series. When I started thinking about the things that I wanted to include in this series that would kind of address prevalent chronic conditions, I knew physical activity was important, but I couldn't decide which angle I wanted to approach it from. You know, if I take different disease processes and go through them and talk about the exercise recommendations for each and the special considerations. But then I thought, you know what, those only apply to like a small portion of people. So today we're going to talk about the benefits and importance of physical activity for anybody, and some of just especially some of the psychological and cognitive benefits that are a little bit less well known, I feel like, than as opposed to medical benefits of physical activity. So I hope that today's talk will kind of re-energize you in regards to continuing on with your physical activity program or starting to exercise a little bit more regularly. So we're going to go ahead and dive into it. So you may know that regular exercise has been shown to increase insulin sensitivity, cardiovascular fitness, body composition. We know that it lowers blood pressure, improves blood lipids. There's a lot of chronic conditions that exercise can positively impact. We also know that being physically inactive or living a sedentary lifestyle is also highly associated with the risk for early death, as well as a whole host of other conditions. So we want to make sure that we stay physically active and we avoid long periods of physical inactivity as much as possible. So these are some of the chronic diseases that are associated with the lack of physical activity. I thought this was kind of a cute comic because exercise really is like a miracle drug. And I think that after today's talk, hopefully you can name at least 3 or 4 positive benefits that you can get from regularly engaging in physical activity. So exercise, aging, and the brain, you know, many of the factors that harm the body also harm the brain. Exercise is unique in that it crosses that blood-brain barrier. It brings oxygen, fuel, fertilizer through nurturing neurotrophins directly to the brain cells, which helps slow the neuron deterioration that's associated with aging. It also helps reduce inflammation. It boosts some of these neurotropic factors, which can also slow the onset of some forms of dementia. Dopamine, I'm going to talk a lot more about later, but dopamine is associated with motor skills as well as motivation. So when we're able to boost those levels, which naturally decline as we age, we're able to help stay motivated. And that's really important, especially as we increase in age. You know, we want to ward off depression, apathy. We want to stay plugged in and stay active as much as possible because we know that that's associated with so much better outcomes for health, but also for quality of life and our own joy and independence in regards to our own personal lifestyle. So hopefully you'll see enough evidence today to kind of help speak to the fact that exercise is not just preventative medicine, but it's also a great tool in your tool chest for treating other chronic conditions, things that you may not even be aware that there's a positive association with. I thought this was a cute little saying, no one can stop the clock, but we can slow its tick. And that's especially true for exercise. You know, if it was a miracle, if it was available as a pill, we would all be taking it. So it's just, there's so much good that can come from it. And I hope that you're able to find and start to think of some ways that you can increase your own level of physical activity. So we're going to go through 10 different ways that exercise helps counteract the aging process. These are in no particular order as far as importance go, but I wanted to tackle the cardiovascular system first. So a strong heart and lungs reduce our resting blood pressure. The result is less strain on our blood vessels in the body and the brain. When we exercise aerobically or even using strength exercises, our contracting muscles release these growth factors. The growth factors help promote the growth of new brain cells and also the growth of new blood vessels. So this helps increase our vascular network, which is really important for keeping us healthy. And in the event that there's a blockage, if we have a more robust network of blood cells, it's a lot easier for us to be able to bounce back and recover from some event like a TI, a transient ischemic attack, a stroke, a heart attack, whatever that may be. So exercise also increases our nitric oxide level. This helps to boost our blood volume and increases our blood flow during exercise, which reduces the hardening of arteries. So that's another key benefit. We know that smoking actually increases the hardening of our arteries, making them more brittle and less adaptive. Exercise can also counteract some of that vascular damage. Stroke victims who participated in aerobic exercise have been able to actually improve their scores on cognitive tests. And I think that's kind of miraculous. If you think about counteracting vascular damage that's already taken place, being able to rewind the clock, so to speak, and being able to recover some of the areas that had been previously damaged is pretty significant for individuals who've been impacted by a stroke. So starting when you're young is ideal, but it's never too late. Exercise also helps promote healthy skin. So it's kind of like it helps cleanse the skin from the inside out. When we increase our blood flow that we already have mentioned, that we get our vital nutrients to our skin, hair, and nails. It helps carry away those waste products, including free radicals, which can damage and age our skin. So the free radicals, that's essentially what we're using sunscreen to help protect against, as well as the sun's UV rays, can damage collagen, elastin tissue, and they help keep our skin firm and youthful. So we know that when we're able to increase our body's production through exercise of natural antioxidants, it can help our skin kind of fight and offset some of this free radical damage. So it's great for promoting healthy skin. By easing our stress level through exercise, we may see some improvement with conditions such as acne or eczema. So if skin is an issue, some people had thought, well, I can't exercise because I sweat so much. And certainly that would be something that you'd want to talk with your doctor about to see if there's a different program that might be more appropriate for you, or to invest in some clothes that might not chafe as much. But certainly it can be used to help promote healthy skin. Exercise also helps regulate our fuel levels as far as our insulin, our glucose, and helps reduce our appetite and burn calories. So as we age, it's really common to increase weight. The CDC estimates that about 73% of older adults are considered overweight or obese. So we want to make sure that, given the fact that we know that there's certain conditions and a number of diseases that are associated with obesity, that we try to stay physically active, because the exercise does help burn the calories, but it also gives us some other benefits in regards to our insulin, IGF-1, which is insulin-like growth factor, which helps to regulate insulin in the body and improves our synaptic plasticity in the brain. So there are some specific benefits of being able to maintain a healthy blood sugar level. We know that the elevation in blood glucose can damage our blood vessels. And so exercise helps to counteract that through IGF-1. It also helps to elevate our stress threshold. We're going to talk more about this in regards to the brain and how cortisol can affect our risk for depression and dementia. But also, I think it's kind of cool that over the course of several weeks, there was some research done out of the University of Georgia. Professor Philip Holmes showed that exercise primed the brain to show less stress in response to new stimuli. So, you get an unexpected event, you get a phone call, someone is not well, a family member or loved one is going through a tough time. Their research suggests that people who are regularly exercising are able to process and move on from those stressful, unexpected events better than someone who's not having exercise or not engaging in exercise on a regular basis. So I thought that was fascinating, as far as not just for dealing with stress during the moment, but over time, how exercise can help your brain cope with stress on an ongoing basis. Exercise also helps improve mood, motivation, and energy levels. So, when you move, you're boosting your dopamine by strengthening the connection between your dopamine neurons. Staying mobile helps us stay involved and connected, which is so important for sustaining mood. As we get older, sometimes it's natural to draw in a little bit more. And and we want to stay engaged as much as possible. I thought. So this road to successful aging really does start with staying engaged and active. When you start to get sedentary and live alone, it can be very challenging. And it's kind of like a downward spiral. It's challenging to start exercising again. It's hard to motivate yourself, but if you're able to keep up with it and stay plugged in, it really does help with your mood through boosting the dopamine in your body and increasing the connection between the dopamine neurons, as well as improving your energy level. We know that people who suffer from chronic fatigue syndrome, as well as some other progressive illnesses, including cancer, HIV, and MS, are encouraged to exercise as they are able. You know, I worked, my passion has always been clinical exercise physiology. And when I was in grad school, one of the areas that we worked in was in cancer. And the hospital that I worked for had a dedicated cancer exercise specialist who would help people get started with exercise while they were in treatment. I mean, while they were going through chemotherapy and radiation, they would come into the hospital for exercise therapy alongside their treatment, and they were taught how to do it safely in a way that would help boost their energy levels as they go through this. So there are certainly benefits for individuals for getting and staying physically active. That being said, you know, if that's something that's interesting to you, certainly ask your doctor about it. I mean, not every person's going to be able to start a cancer exercise program, and there were certain criteria that individuals had to meet in order to participate with that. But, you know, there's a lot of benefits from starting where you are and starting slow and then listening to your body. So we'll go through those later on today anyways. It also helps improve your strength and preserves your bone mass. So for those of you who are concerned about osteoporosis or osteopenia, which is like the weakening of bone mass, exercise is really essential for reducing muscle loss and maintaining your strength as you age. It helps reduce the risk of fractures, disabilities, and we really want to make sure that we stay strong. You know, I heard a long time ago that one of the things that is putting people in nursing homes, seniors in nursing homes, was the ability that they could not get out of a chair. So staying strong, being able to have those bones. And we know that one of the things that increases your likelihood of bed rest is a fracture. So being able to preserve your bone mass is really so critical, because we want to be able to preserve muscle mass, and they really do go hand in hand. The more up and able and active we can be, the easier it is to help preserve our muscle strength and integrity. Exercise also helps improve sleep quality. I'm curious if some of you have noticed this before, but we know that older adults tend to be more affected by sleep disorders. So I wanted to include this one because I thought it was important. We know that regular aerobic exercise can increase the amount of slow wave sleep that you get, and that's like the restorative sleep. So that's wonderful. Now that's a benefit that is seen mostly with aerobic exercise, such as walking or biking, something that is rhythmical and continuous in nature that uses larger muscle groups. Dancing would be included with aerobic exercise also. It's also been suspected that the increase in core body temperature that occurs during exercise might actually help improve sleep quality by helping it to dip or drop during sleep. I don't know about you, but I always sleep better when the room's a little bit colder. And so exercise can help prime your body for being able to drop the basal temperature rate. There is something to be said for when you exercise. So you have to kind of play with the timing. Sometimes that drop can come 60 to 90 minutes after you finish exercise. And then if you're like me, you probably don't want to exercise too close to when you want to go to sleep, so that you're able to actually fall asleep easily. But it does help kind of decompress your mind a little bit. It helps to stabilize your mood. And those are important factors for getting you to sleep quickly as well. Exercise can reduce pain, and one of the biggest things that I've heard from people who suffer from arthritis, especially knee osteoarthritis, is the pain that comes from physical inactivity. They've noticed it. They've noticed that when they're not physically active, their joints start to hurt more. So used appropriately, again, listening to your body and not pushing yourself beyond what you can comfortably do, and you certainly never want to cause acute pain, but during exercise, the body releases these opiates, endorphins, and other substances that help to dull our perception of pain. We know that moderate amounts of exercise have been shown to increase our tolerance to pain, as well as to decrease our perception of pain. So it kind of goes both ways. It could be an effective way to reverse the downward cycle of deconditioning and worsening pain. So if you can stay active, and again, listen to your body. We don't want to overdo it, because if you have like fibromyalgia, for example, you may be well aware that you can overdo it, and that can make it even harder to get back on the wagon. So taking it slow and then listening to your body, and always just smaller chunks, especially if you're getting started. But that can improve quality of life, as well as your ease of completing activities of daily living. So it can help control those pain conditions, pain associated with low back pain, fibromyalgia, chronic shoulder pain, and that is huge in my opinion. Exercise also helps boost the immune system. So it does it through a couple key ways. One, it increases the activity of the immune system's antibodies, which attack the bacterial and viral infections. And it helps improve the activity of the lymphocytes, which are the T cells, which make the body more alert to conditions such as cancers. So there's, the population studies really bear this out. The most consistent risk factor for cancer is the lack of physical activity. In fact, 50% you have a 50% lower risk for colon cancer if you're physically active. So we know that these T cells, these lymphocytes, are really crucial to kind of recognizing those broken cells or fragments that need to be fixed. And they alert the body to that, so that we can keep those damaged cells corrected. We can keep the inflammation under control. Again, when those spots fester, you're left with elevated, typically C-reactive protein, which is a lot why many of you are your doctors include CRP or C-reactive protein in part of your lab results on a regular basis now, because as we get older, that level can increase, and when it increases beyond a certain amount, it's kind of a key risk factor that there might be something going on in your body, whether it's cardiovascular disease, Alzheimer's, or you have a knee issue. And sometimes if you're even having joint pain, that's the frustrating part. We don't know where the inflammation is coming from, but we do know that exercise can help boost your immune system and help you fight off and control it a lot better. The last specific benefit for exercise is it helps to foster neuroplasticity. Neuroplasticity is a big word. I have to use some big words today, but I looked up the definitions so we could all learn together. Neuroplasticity is the brain's amazing ability to adapt and change. So basically, if your brain is not busy growing and learning, it's slowly dying. So we always want to stay active, and so many of you are doing this so well. You're always learning, you're staying involved and connected with other people, with your community groups, and especially this time with COVID-19, it is not easy. So I have a huge kudos to you for making the efforts. I mean, doing this through a computer screen, it's not ideal. It's not how I like to do things. But you're here and you showed up. So I'm really impressed with that. The exercise helps strengthen the connections between our brain cells. We're going to talk a little bit more about this and how it strengthens the activity at the synapse. But it basically, when we exercise it stimulates the release of those neurotropic factors, which help stimulate more brain cells, and it really helps to strengthen the brain. So again, these structural changes are huge. Again, it helps kind of prime our brain to handle anything that it comes into encounter. As we age, our brain cells and connections start to deteriorate. This starts at around age 40. We lose on average 5% of our overall brain volume per decade. So that's like shocking to me. The neurons get worn down from cellular stress. We mentioned cortisol earlier. Our synaptic activity, and I have a slide to show you where that is, decreases, and our brain cells start to atrophy. So there's a lot happening there. Our brain growth factors, our dopamine, which declines, both of those things decline with age. So you can see here on this picture, this synapse is the space between that axon and the dendrite. So that's where a lot of these signals take place. And as the blood volume starts to decrease, again, if we're not physically active, which also helps to increase blood volume and neuron activity, the space between those synapses widens and there's less activity there. And when there is less activity there, those synapses start to decay. So if that synaptic decay outpaces the new activity and the creation of additional synapses, we start to notice some problems. And it might be minor at first, and it could be ranging from anything to a mental decline, dementia, to Parkinson's disease, depending on which axons and which dendrites are affected. So depending on where in the nervous system we're seeing the decay or the synaptic spaces, it may affect your motor system or your cognitive system, your brain and your nervous system, one more than the other, so to speak. So it's huge, not just for your physical well-being, but obviously you can see some of the benefits here for your brain. This BDNF is basically like miracle grow for your brain. It's brain-derived neurotrophic factor. I wasn't even going to like put it in a presentation because it was just too much. It was just a lot. But BDNF, for those of you who want to know, it's brain-derived neurotrophic factor. And what it does is it pulls near these synapses, the ones that you just saw. And it helps, when we get it, it helps increase the activity at the synapses. It floods that prefrontal cortex and helps increase our cognitive flexibility, as well as it really encourages the growth and transformation of new blood cells. I'm going to try to mute. If you're on mute, if you could mute yourself, that would be super helpful. Try to do it. Awesome. Exercise is the only thing that crosses the blood-brain barrier. So it activates the release of this BDNF, and it also feeds the brain glucose, which is crucial, and oxygen, which builds the greater connections between the neurons. After you finish exercising, blood flow almost immediately shifts back to the prefrontal cortex. And this is the perfect time then to focus on a project that demands critical thinking and complex analysis. The prefrontal cortex is also where we do like our executive functioning skills, where we process, analyze information, or critical thinking skills, so to speak. Okay, so I wanted to do a brain break with you. This is just something that requires us to coordinate our movements. It's quick and it's an easy way to wake your brain up a little bit. You've been sitting for half an hour, so you know me, we are not totally going to avoid exercise altogether, just to help reset the brain. So the two activities that I picked, the first one is called ear, nose, switcheroo, and I'm hoping you could see me. I'm going to go off of screen share for a second. Yay. Okay, can you see me? Okay, so for the ear, nose, switcheroo, you're going to take your left, wait, I got to get this right. Left ear with your right hand. So take your right hand and touch your left ear. Yes. And then take your left pointer finger and touch your nose. Like this. So right hand, left ear, pointer finger. On the other hand, touch your nose. And then we're going to switch it. And then switch it. Ah! And then switch. And then switch. The goal is to see how fast you can go. I know, it's so silly. You guys are doing awesome. You're going to wonder. It's so funny to watch it on video. Did you try it? Okay, if you try it. So that's ear, nose, switcheroo. Again, right hand, left hand, right hand to ear and nose. Super easy. The next one is ABC 1, 2, 3. So for this one, take your dominant hand, whether it's right hand or left, and we are going to count together while we outline with our hand. So outline the alphabet. You can go big. Let me step back so you can see me. So I'm going to do A, except for instead of saying A, I'm going to unmute everyone. I think we can do this together. It'll be fun. Okay, you're all unmuted. We're all going to do it together. We're going to count one, but we're going to trace the letter A. I'm going to go all the way through the alphabet. So if we do it right, we will end and say number 26 as we are writing the letter Z. Yes. I do this in person. It works better in person. We're going to try it here. So stand up. Chairs. Get your hand out. One, we do the letter A.
Do the letters of the alphabet.
2,
B.
3,
4 is D.
4,
5,
5,
6,
6,
7,
7,
8,
9,
10,
10,
11, 12, 13 is M, 14, 15, 16, 17, 18 is R, I think, 19, 20, oh, just a second, 21, I think I'm on you, 22, 23, 24, 25 is Y, and 26. Yay, I see some of you did it. I'm so proud of you. You can try your non-dominant hand. Yeah, it's just a little brain activity break. You can do bigger letters to try to get both sides of your body involved a little bit more. But that's your silly brain break for today. You did good. Can you still hear me? I'm going back to screen share. Yay! Awesome. So that's our brain break. It's good to do that. When I have students that I'm working with, I encourage them to stop every 20 minutes and put aside their studying and get up, get active, because an object at rest tends to stay at rest. And you know how this is. If you've had a day where you've just been on the couch all day or on the phone all day, or you've just been sitting all day, it's easier to go home and sit some more. So this is really a problem for individuals who are working desk jobs. The sedentary lifestyle of working a 9-hour day at a desk and then going home and sitting some more in the evening is really starting to catch up to us in the US. So definitely some dangerous behaviors there. This study is a huge landmark study. The University of Illinois did a huge study looking at previously sedentary seniors, individuals aged 60 to 79. They were led by neuroscientist Arthur Kramer, and they divided this group of about 59 seniors. So it wasn't a huge group into two groups that went to the gym 3 times a week for an hour over the course of 6 months. The control group embarked on a stretching routine while the others walked on the treadmill for the duration of the time. So not a complicated exercise routine, just walking on the treadmill. They started out at about 40% of their maximum heart rate, so a pretty low level of intensity for their walking, and then kind of gradually increased it to 60 to 70% of their maximum heart rate. The only variable was fitness, and after 6 months, the walking group averaged a 16% improvement in VO2 max, which is kind of our measure of cardiorespiratory fitness level. So this is really common. It's seen a lot in literature. So they had a 16% improvement. However, the groundbreaking studies, the finding came when they looked at the brain scans. So they found that they did MRI brain scans before and after of this 6 months exercise program. They found that those who had the increased fitness levels had an increase in brain volume in the frontal and the temporal lobes. They thought it was possible, but they were shocked. The researchers were shocked to really see that it was there and measurable. So their takeaway from this, Kramer and some of the other neuroscientists who were involved, was that exercise not only keeps the brain from rotting, but it reverses some of the cell deterioration associated with aging. So the increase in brain volume was really groundbreaking, and the researchers were shocked at that, the fact that they were able to increase brain volume just through exercise. In the scans, they noted that the exercisers' brains looked 2 or 3 years younger than they actually were. So that was how just 6 months of walking on the treadmill 3 times a week. That is mind-blowing to me that they could see that much of an improvement. So I know a lot of you are already doing this. So I hope this is like a good attaboy for keep up with it, because it's making a huge difference. Your brain is going to look better. We've all seen like the pictures of the smoker's lungs with a healthy lung and the smoker lung. Well, basically, your brain on exercise is going to look way different and larger than someone who's living a sedentary lifestyle. One of the other studies said something to the effect of, you are healthier as an active 60 to 70-year-old than you are as someone who's sedentary between the ages of 20 and 30. So that in and of itself is amazing. Other psychological benefits of exercise. So one of the reasons that I really have to exercise is for the psychological benefits. Not only do I need the physical, but I love the release and the mood boosting benefits. It helps control my anxiety, and I've seen huge improvements as far as my own quality of life and my depression levels. So I know that this might be a shock to you, but I am very much a glass half full kind of person. But sometimes there's been some changes, and I notice a huge difference in how I feel mentally and my overall perspective on life, like whether things are looking okay or just everything is, very serious, based off of how I'm exercising. So, when I'm able to get 2 or 3 days in, it really does a lot for my own mental well-being. And there's some research supporting this as well. There's actually a book that I really encourage you, if you're interested in reading research studies, but like you like the sciencey side of things in a way that's readable. Dr. John Rady is a practicing Harvard psychiatrist, and he wrote a fantastic look, and a lot of today's talk, portions of it were included in the book, The Revolutionary New Science of Exercise in the Brain. It is not new. I think it was published in 2008. But it's got some really good stuff in it, and it's a really enjoyable read. He goes into addiction, like exercise, and how it can impact addictions, aging, Alzheimer's. He's got like different sections of the book, and it's fascinating. So if you might be able to find it at the library or online if you have an online library card. One of the things that they do in Great Britain was use exercise as far as a first-line treatment for major depressive disorder or depression. It's not utilized as much in the United States, which is sad, but in Great Britain it is. One of the things that Dr. Rady had written in this book was, if everyone knew that exercise worked as well as Zoloft, I think we could put a real dent in the disease. Now, I'm not telling you to go off of your depressive medications. I'm encouraging you to consider adding an exercise in addition to them. There's a really good research study. We're going to skip this and come back to it. By Blumenthal et al. And some of his colleagues, they randomly assigned adults who had been classified with major depressive disorder to either a 4-month course of exercise, medication using Zoloft, or a combination of both. This is remarkable to me. All 3 groups exhibited significant improvement. Again, and most could be classified as not even having major depression any longer. And then they did a follow-up study to it after 10 months, and this was a different one, Babiak, found that subjects in the exercise group had a significantly lower relapse rates than those in the medication group. So regardless of treatment, whether it was Zoloft, exercise, or both, all of them improved, but the exercise groups actually had lower relapse rates than those in the medication group. So that, suggesting maybe that exercise had other benefits that kept people coming back to it or made it easier for people to stick with. or it had more of a protective effect. I'm not sure. I don't know if they've hypothesized as far as what the mechanism was, but fascinating stuff. So exercise increases our endorphins, which is kind of that general feeling of well-being. And typically endorphins are associated with exercise that is aerobic in nature and lasts for longer than 30 minutes. So not every time you exercise, you're going to get that runner's high, so to speak. Exercise also increases our endocannabinoids, which reduce pain and help us to increase our overall life satisfaction. But importantly, it targets all of the neurotransmitters that are targeted by antidepressants. So norepinephrine, dopamine, and serotonin, those are our three big ones. And all of those would be targeted by one or more of the major types of antidepressant medications. So norepinephrine wakes up the brain, gets it going, it improves our self-esteem. Dopamine improves our mood, attention, our feelings of wellness. Serotonin is crucial for mood and for impulse control and self-esteem as well. It also helps reduce cellular stress by counteracting cortisol. So it has more ties to learning and kind of our overall brain health and well-being than some of the others do. But it primes those cellular connections in the hippocampus as well. So in addition to all of these, you feel good when you exercise, and that is not traced to anything. You know, when you are feeling good and you exercise, you feel better, and then you get the sense that everything is going to be okay. And when you're feeling down and you exercise, then you see how it shifts your entire well-being and your perspective, and maybe it would encourage you to continue on with the exercise. So there's something there, and we haven't exactly figured out what all the pathways or chemicals or the reasons why, as far as why exercise is so helpful for depression, but we know there's something. The adherence is critical. So, and again, it can be so difficult when you don't feel like doing anything and you don't feel like getting out of bed. It can be difficult to even, it can feel overwhelming to start an exercise program. And one of the things that psychologist Jasper Spitz, he wrote a book about this a while back, had suggested was giving yourself permission to start. So if you are someone who deals with depression, maybe if you are considering adding exercise, you give yourself permission to stop after just 10 minutes. If it's still not feeling good, as with some health benefits, you don't get the benefit immediately, but with exercise, within 10 minutes, you should start to see some improvement in your overall mood and energy levels. So giving yourself permission to quit after 10 minutes may be something that you could consider as a way to help get yourself started. And then if you only do 10 minutes, you know, give yourself a pat on the back. You did 10 minutes. But using exercise as a reason to exercise, using exercise as a reason to get moving as opposed to a barrier can be really, really crucial. So almost anyone at any age can do something for physical activity. You can talk with your doctor about what types might be safest for you or what types might be most appropriate, but try to find activities that you will enjoy and would have access to be able to do on a regular basis. Choose things that are comfortable, that are familiar to you. There are some really substantial additional benefits to doing things like Tai Chi or yoga, because they also have other ways that they help to reduce anxiety and enhance relaxation and stress levels because of the way that they incorporate some mind-body work and some breath work. So there's certainly some other benefits with yoga and Tai Chi, also for balance. So if your fitness level is low, think about just starting with shorter sections of maybe 5 or 10 minutes. Space them throughout the day. Use your alarm on your phone if you have one. Maybe find a friend in your neighborhood who'd be willing to walk with you at a certain time of the day. Just keep in mind, something is better than nothing. So doesn't have to be, you may have to change in your mind what you're thinking of when you think of physical activity. If you are one of those, my husband is like this. He's like, it's not exercise unless I'm on a bike for 60 minutes. No, that may have been you 30 years ago, but gardening can be physical activity, being out active in your yard, doing yard work, raking. It doesn't have to be the way that it was before. So getting started, just remember, something is better than nothing. Chair exercise, absolutely. Take a couple extra laps around Meijer when you're there for groceries, sure. Just find things that you enjoy and that you can do safely. Start slow. I feel like I've said that a lot, so I think you got that. Use safety equipment if it's suggested. Proper footwear, absolutely. Playmakers is wonderful about fitting people here locally for shoes that will be appropriate for them based on their own gait, meaning they can do a gait analysis, they can look at your foot, at the shape of your foot, how you walk, and suggest something that might be a safer shoe for you. Unless your doctor has specifically asked you to limit fluids, I encourage you to make sure that you're staying well hydrated during the exercise. And then again, it should not hurt or make you feel overly tired. So for those of you with special conditions, I wanted to share this with you. This is the American College of Sports Medicine has a whole initiative called Exercise as Medicine. I went through and actually got Exercise as Medicine certified as a EIM level 3 trainer several years back, because they really support, I'm going to try to pull this up so you can see it. Good having appropriate expert advice for individuals who are suffering from specific medical conditions. So I'm going to scroll down. I think you can see it. Oh, I don't know if you can see it here, but it's got Alzheimer's, asthma. Let's see if I can share my. I'm going to try to share this one just a second so you can see it. Okay, now I'm here. I think I'm sharing it to you. So you can see Alzheimer's. It's got Spanish versions for asthma, AFib, bleeding disorders, cancer, chronic kidney disease, chronic liver disease, COPD, depression, heart failure. So for example, if you pull one of these up, let's just pull up high blood pressure, which is hypertension. And it'll tell you what you need to know about getting started, what type of activities might be recommended for someone who has high blood pressure, some special considerations. So this is a great resource. You don't have to reinvent the wheel, as opposed to spending the entire presentation talking about different conditions. I just thought I'd point you to this excellent resource, and you could each look up your own individual ones. I'm going to stop sharing that and go back to my PowerPoint. So remember, sticking with it is easier than starting over. Not easy to do, and just little bits at a time. If you take a day off or a week off, you're on vacation or you're sick and you don't feel up to exercising, just get back on when you're able to. These are just some ideas for helping to stay motivated for yourself. One of the things that I find is trying to make it fun. I listen to books sometimes when I walk. Find a buddy to walk with. I think that exercising with a friend is always better, but not everyone enjoys that. So you figure out what is going to work for you. There are lots of online options now, even more so than there were before because of COVID. So I want you to remember that regular exercise can positively affect your cognition. It increases our growth and activity of neurons. It promotes neurogenesis, angiogenesis, in key areas. So both our brain as well as through the rest of our nervous system and our body. It helps prevent a lot of chronic diseases. It decreases the symptoms of stress and anxiety that we would experience. It helps boost our mood, improve our resiliency, which is our ability to be able to bounce back after an unexpected event. But I really hope that now that you understand all of these wonderful mental, physical, emotional benefits of exercise, that you will continue to follow or begin following your own exercise prescription. So that's what I have to share with you. I hope that it was helpful. I hope that you learned some things, and I would love to take any questions that you have. Here's my sources. I'm gonna get rid of this here. I'm gonna go back to my main picture. So what questions? Are you currently exercising? I see some of your faces. It's nice to see faces. I hope that you are. And if you're not, I hopefully you'll consider getting started. It doesn't have to be anything, you know, doesn't have to be anything crazy. Doesn't need to be going for a run. Let's see here. Can you get the slides to this presentation? I can send it to you. Yep. Just will you shoot me an email afterwards so I know who wants it? I did have specific recommendations, and I was like, man, they're going to be bored to death. No one knows what heart rate reserve is, but I just figured if you start doing something, if you listen to your body, exercise, you should be able to carry a conversation. You should not be out of breath. So if you're walking and your friend is walking too quickly for you to be able to participate in the conversation, you got to slow it down, lower the intensity level. With stretching, exercise you should stretch to a point of tightness, but not pain. And when you are lifting weights, you should do as much as you can with good form. So you want to maintain proper form until you want to go to a near complete muscular fatigue. So when you're doing exercise classes with me, you probably heard me do reminders all the time about that. But you should give yourself a challenge. You should be tired, but not in pain. So listen to how those muscles feel. Afterwards, you want to stretch out, help decrease the likelihood of any delayed onset muscle soreness, which typically peaks after 2 days. So as you get stronger, you have less soreness, which is the really good thing. Yes. Oh, okay. For those of you who do not participate in the lifetime exercise classes or who haven't in a while, I do have a lifetime channel with exercise listed. I mean, a whole bunch of old lifetime classes, and I'm adding new ones. So if you're interested in that, shoot me an email afterwards and I can send you the link to the lifetime exercise playlist. If you've attended a class since June, you have a link to the playlist because I've just been emailing them afterwards to people. But it's not too late to sign up. We have Tai Chi on Thursday with Jan.
Hi, Jess.
And we have a group walk on Thursday at 2 o'clock.
Listen this. Oh, she just quit talking. I'm on the web RX with.
Is that Janice?
Yes, that is. My question was, I don't know which number goes with which alphabet, so how do you keep track of both of them? Because I can't count and say the alphabet at the same time.
So you only say the number and then you use your hand to trace the letter.
Oh, okay.
Yes, and it is not easy. I did it for a group of new Sparrow caregivers probably 6 months ago, and I ended at number 25, and I was definitely writing a Z. So it's a challenge. If you have grandkids, see if they can do it.
Oh, okay. I either have to write the number down or the alphabet down so that I can only keep track of one.
I know. Where your brain is doing one thing, you're counting, and your body is writing a number that is not what you're saying out loud.
Well, yeah, that was really fun, though. I like that.
Oh, good.
I've got other family members I want to test this on. That's why I wanted to get it good.
Good.
Katie,
Yes.
are all your slides and everything in the thing that we're going to get on the 17th?
Yes. The handouts look like here. I just printed a whole bunch of them off. They're the outlines. It's not the slides.
Oh,
If you want the PDF of the PowerPoint presentation that would have like pictures, you could email me and I will email you the PDF of the PowerPoint. The outlines, I could increase the font, and I had to keep each outline to 6 pages or less. So I was able, for printing and good stewardship of resources, they are just outlines because I wanted to make sure that everyone could read the text on them. And when I printed the PowerPoints, the text was itty bitty. So,
thank you.
Yep. Other questions? Well, that's a wrap. Next week we have diabetes with Carol Tucker. Carol's a nurse practitioner. She's worked in diabetes for years. She's a fantastic educator. She's really passionate about the subject. So if you have questions for an advanced practice provider, especially as it relates to diabetes treatment, diabetes care. Carol is the person to ask. So she'll be here with us next Tuesday for our final session. Thank you again, and thank you for your patience with me as I muted myself. I know I did it. I don't know how I did it, but I did. So thank you for telling me and for hanging with me so that we can get it back up. And I'll see y'all next week or on Thursday at our Tai Chi or walk.